Well, joining us this morning is Dr. Joel Cohen with About Skin Dermatology. Thanks so much for being here.
My pleasure.
Okay, so we're talking about fillers, and there are quite a new things with them. First, let's explain what is a filler and what does it do?
Filler is something that's injected underneath the skin to lift the area. So the most common area to inject is this area, the smile line,
Sure.
so that it can restore volume and youth to that area.
Okay, so it makes a lot of us look younger.
Yes.
I know you're involved in quite a few clinical trials, and I understand you actually just did one with facial injectables.
We do a number of clinical trials, and there's a lot of new things that are out there, even in the past few months. First of all, there's new products out there. There's something called Belotero, which has been used in Europe for a number of years and now has just been approved to be used in the U.S. There's products that have been out there for a long period of time, such as Restylane, which was just approved for use actually in the lip itself. And then secondly, third, there's a new way to deliver products where we actually use cannulas so that there's less bruising and swelling after a procedure.
Okay, so how do you know, with so much out there, how do you know what's the right product for you?
When you see an experienced dermatologist or plastic surgeon, generally they have a sense of what is best for you in terms of your overall goal. Belotero is probably going to be a very popular filler for the area underneath the eye. We tend to use a lot of Juvederm into the area around the nasolabial folds, we call it here. And then, as I said, Restylane was approved for actual injection into the lip. And then we use things like Perlane to lift up the corners alongside the mouth.
I mean, you really can do whatever you want to do. These, unfortunately, the fillers are kind of like Botox. They only last for so long, correct? How long do they last and what do they cost?
So in general, filler products last up to a year, and that's carefully worded. Restylane and Juvederm really, someone's first injection can last 8 or 10 months. After additional injections, they can last even longer. But it's important to realize that the more you get, similar to Botox, sometimes the longer stretch of time it is in between products.
Okay, and I mean, we're looking at some of these photographs of kind of before and after things. I'm assuming this is kind of a lip filler right there. It looks pretty nice because sometimes you see the people walking around with these massive lips going, oh no, where did they go and what happened to them?
So, you know, avoiding the trout pout is very important, and seeing an experienced dermatologist or plastic surgeon is critical because there are things to keep in mind. There are blood vessels in the lip themselves. There's also a brand new product called Lavive, and Lavive is really a patient's own individualized, personalized injection product.
Okay.
It's their cells taken from behind the ear that are sent for culture, and within a couple of months they come back, and then patients are given their own collagen-producing cells. So you inject it along the fold that we've talked about. You can inject it into the cheek, into the corner of the mouth, and it's a natural product because it's patient's own collagen-producing cells that we're putting right back into them. So this just got FDA approval. We just started doing this. I'm a trainer for this area. So it's really exciting to be part of this.
Wow, very cool. Great information. And of course, we've got additional information and how you can actually get a hold of Dr. Cohen on our website, thedenverchannel.com. We'll be right back.